So JOGO is a very interesting technology that many decades in the making. Many years of research at NYU Rusk Institute, developed by Dr. Joe Brudney, a very accomplished neurologist and physiatrist. These were very big machines using this basic technique called EMG biofeedback that helps retrain the brain to get more control over the muscles. So this is the basic mechanism. It's very useful for post-stroke disorders of movement, spasticity, etc. So a lot of patients, 20% of patients after stroke have what's called spasticity, dystonia. They cannot move properly. So this helps very well. In terms of urinary incontinence, voiding dysfunction, these are all different problems associated with the urinary system. And as you heard in the presentation, patients leaking without any control, patients not able to empty their bladder. It's very painful, and they cannot function. They cannot have a normal life. They cannot concentrate on work, go to a social event, or even travel for more than an hour. They have to plan a lot because they have to go to the bathroom every 1 hour or so. So life is very difficult. So this treatment helps for the patients to regain control. Instead of leaking when they are coughing, sneezing, etc., they can be dry, as they call it. So they have more dry days. They can manage, they can travel, and have a very normal life. So that's what we are helping a lot of patients in Chennai, Tamil Nadu, and many locations across India: Mumbai, Delhi, Kolkata, Coimbatore, Madurai, and few more cities in India. So there is 1 out of 3 women after a certain age will have this problem because of childbirth, etc., as well as aging. So a lot of women don't know that this can be treated. They don't even share with their husbands that there is this problem that needs a solution. They try to manage with diapers and struggle with life. Doesn't have to be. This can be treated very easily. 2 months of treatment, and they lead a very normal life. So with that, I'll conclude my remarks.
Treatment areas, where these treatments can be used? How many sessions you said? How many sessions?
So if it is incontinence related to the urinary system or the bowel system, see, chronic constipation, they cannot pass stools. And so this kind of conditions take about 8 sessions, typically over 2 months, 1 session a week for 8 weeks. If it's Parkinson's tremors or essential tremors, anything to do with neurology, it takes a longer time. Depending on how severe the problem is, it can be anywhere from like 2 to 4 months they have to take the treatment. So when we do the evaluation, we can assess that patient properly and tell them how long they'll need the treatment. For migraine headaches, for chronic pain like chronic low back pain, cancer pain, etc., it's typically a 6 to 8 week treatment. Once a week for 6 to 8 weeks, and they get rid of this problem.
10 sessions.
Yeah. The pelvic, which is the incontinence, it takes 10 sessions, so 2 to 2.5 months.
ஒன்று வந்து மசில்ஸ் டைட் ஆகிடும். எந்த கண்டிஷன் டைட் ஆகணும்? ஸ்ட்ரோக், பார்க்கின்சன், க்ரானிக் கான்ஸ்டிபேஷன், அந்த ஃபீக்கல் மசில் டைட் ஆகிடுது. ஸோ அதை வந்து நாங்கள் ரிலாக்ஸ் பண்ணிட்டு நார்மல் ஆக்கிடுவோம். அதே சைடு இந்த சைடு பார்த்தீங்கன்னா மசில்ஸ் லூஸ் ஆகிடுது. ஆஃப்டர் 60 years 70 yearsனா தான் யூரின் லீக் ஆகுது. சில டைம்ஸ் வயசானவங்க பார்த்தீங்கன்னா நடக்கும்போதே உச்சா லீக் ஆகும், கக்கா பண்ண லீக் ஆகும். ஸோ அதை வந்து நாங்கள் அந்த மசில்ஸை டைட் பண்ணுவோம். ஸோ இது எப்படி டைட் பண்ண? இந்த டிவைஸ் வந்து 1,000th of a millivolt. Millivolt is the smallest unit. ஸோ அதோட இன்னும் ஸ்மால் மர்மரை கூட கண்டுபிடிக்கும். இப்போ தெர்மோமீட்டரை லாஸ்ட் 50 years ஒன்றும் ரீப்ளேஸ் பண்ண முடியல. சிடி ஸ்கேன் மாதிரி வந்து, பட் தெர்மோமீட்டர் ஸ்டில் த இண்டிகேட்டர் ஃபார் ஃபீவர் 98.3 or something. அதே மாதிரி இது ஜஸ்ட் டெல்ஸ் யூ வாட் இஸ் யோர் மசில் ஸ்ட்ரென்த், வாட் இஸ் யோர் மசில் ஃபங்க்ஷனிங். அந்த லெவலை கரெக்டாக கண்டுபிடிக்கும். நீங்கள் பண்ண இப்போ நீங்கள் ஜிம்முக்கு போகிறோம், எக்ஸசைஸ் பண்ணுறோம், நம்மளுக்கு என்ன பண்ணுறோம்னு தெரில. ஒரு 3 மாதம் கழிச்சு ஒரு சின்ன கர்வ் வருதோ, ஒரு நியூ மசில் வருது. பட் இது வந்து எவ்ரி செஷன் வி கேன் மெஷர் த இம்ப்ரூவ்மெண்ட். ஸோ திஸ் கோஸ் as a feedback and forms of neuroplasticity. இது வந்து பெயின்லெஸ், நான் இன்வேசிவ் அண்ட் வெரி இம்பார்ட்டன்ட். இட் கேன் பி டன் வர்ச்சுவலி. இப்போ ரீசனாக அந்தமான்லேருந்து ஒரு பேஷண்ட் ட்ரீட் பண்ணோம், ஒரு மொபைல் ஃபோன் வச்சு. ஸோ நிறையா பேர் டைப்பரோட கஷ்டப்படுறாங்க. ஸோ அவங்களுக்குலாம் இது ஒரு சர்ஜரி தேவையில்லை, பெயின் தேவையில்லை. ஸோ ஜஸ்ட் பை எக்ஸசைஸ் அண்ட் அவங்க வந்து கண்டினியூஸாக அவங்களுக்கு தெரியும் என்ன பண்ணுறோன்னு. அந்த மாதிரி இது வந்து குளோபல் ஆர்கனைசேஷன், யூஎஸ்எஃப்டிஏ, அந்த மாதிரி பெரிய பெரிய ஆர்கனைசேஷன் அப்ரூவ் ஆயிருக்கு. இது வரைக்கும் நாங்கள் இந்தியாவில் 15,000 பேஷண்ட் ட்ரீட் பண்ணியிருக்கோம். 10 சிட்டியில் இப்போ வி ஆர் அவைலபிள். டெல்லியில் 10 சென்டர்ஸ் இருக்குது, பாம்பேயில் 3 சென்டர் இருக்குது, பெங்களூரில் 8 சென்டர் இருக்குது. ஸோ அந்த மாதிரி வி ஆர் டெவலப்பிங் அக்ராஸ் த கண்ட்ரி. ஸோ திஸ் அ நியூ பிரேக் த்ரூ. இப்போ மொபைல் எப்படி ஆண்ட்ராய்டு ஃபோன் வர மாதிரி இட்ஸ் அ நியூ டெக்னாலஜி பிரேக் த்ரூ, ஃபர்ஸ்ட் டைம் இன் த கண்ட்ரி. இன்னைக்கு வந்து இந்தியாவில் லார்ஜஸ்ட் pelvic floor therapy ட்ரீட்மெண்ட்னா JOGO is one of them.
It's available in doorsteps.
We do home care also. We do home care within city limits.
ட்ரீட்மெண்ட் வந்து ஹாஸ்பிட்டல்ல
இல்லை, எங்கே வேணால் பண்ணலாம். வீட்டில் பண்ணலாம், கிளினிக்கில் பண்ணலாம், ஹாஸ்பிட்டலில் பண்ணலாம், வர்ச்சுவலாக பண்ணலாம், எங்கே வேணால் பண்ணலாம். ஒரு தனி ரூம் வேணும். இது 33,000 ஏன்னா ஒரு செஷனுக்கும் நாங்கள் ஒரு 1000 ரூபாய் கிட்ட கன்சியூமபிள்ஸ் வந்து ஸ்பெண்ட் பண்ணுறோம். இந்த கிளாத் எலக்ட்ரோடு இது வந்து இம்போர்ட்டடு, இது இந்தியாவில் கிடைக்காது. ஏன்னா இங்கே இருக்க எலக்ட்ரோடும் இந்த ஏரியாவில், இந்த பெல்விக் ஏரியா எலக்ட்ரோடும் டிஃப்ரெண்ட். அங்கே முடியலாம் இருக்கும், எலக்ட்ரோடுக்கு போய் முடி வந்துடும். ஸோ அது வந்து ஸ்பெஷல் எலக்ட்ரோடு யூஸ் பண்ணுறோம். அதே மாதிரி பேட் யூஸ் பண்ணுறோம். ஸோ சில டைம் ட்ரீட்மெண்ட் பண்ணும்போதே சில பேர் உச்சா லீக் ஆகும். அப்போ வந்து நாங்கள் சொல்ல முடியாது, இல்லை ஒரு எலக்ட்ரோட கொடுப்போம், மாற்றணும். ஸோ லாட் ஆஃப் திங்ஸ். அதே மாதிரி ட்ரெயின், இதுதான் நார்மல் எலக்ட்ரோடு, இதோட சின்னதாக இருக்கும், இந்த சைஸ் தான் இருக்கும். யூஎஸ் வந்து நெக்ஸ்ட் வெர்ஷனும் வந்துருச்சு, வர்ச்சுவல் ரியாலிட்டி வந்திருக்கு. ஸோ லாட் ஆஃப் அட்வான்ஸ்மெண்ட்ஸ் ஆகும்.
It's exciting to embark on this new partnership with AINU. My name is Sanjay Murli and I'm the founder and CEO of JOGO Health. Mayo Clinic is one of our backers. We are invested in the company. We also came out of few innovation programs, Johnson & Johnson, MQB2, as well as Brigham and Women's Hospital. So this has been a therapy that's been decades in the making. So Dr. Joe Brutney is one of the brains behind this therapy. He is a neurologist and a physiatrist. And the story is that he escaped the Holocaust in Germany during World War II, came to New York, and this is the time when physical medicine and rehab was becoming started. So there was a lot of veterans with polytrauma, a lot of brain injuries, for which no treatment existed. So he came up with this whole idea of using what's known as EMG biofeedback to help re-educate the brain to get control over the mind. So on his own, he teamed up with Dr. Gordon Silverman, whom you see here in the color picture, and they built one of the first machines with IBM cell, and it was very, very successful. This is a big machine he had built. However, he was very passionate. He could spend long hours to test the machine and treat patients who had excellent improvement. But this was not commercially viable because it was very expensive, very time consuming. So my background is in technology, and so I helped shrink the big machine into a very, very small, portable, easy to set up machine. Whereas before it used to take 40 minutes to get it going, now it takes about 2 minutes. So it took us about 6 years to build this technology. EMG is not a very easy signal to work with, to get good level of accuracy and readability, and to make it work reliably across different pathologies. It took us a lot of time. But once we got it working,
clinicians absolutely loved it because they had seen, heard about this, studied about this, but there was no easy to use technology to put it to use in different use cases. So how does this work? So to give you a simple example, you've heard about Pavlov's dog, the Russian scientist, who trained the dog with a bell and a bone. So he would ring the bell and give the dog a bone. So the dog's brain got conditioned expecting a bone every time his bell was rung. So this is a very crude way of explaining operant conditioning. It's a learned behavior. And by giving real-time feedback to the brain of what the muscle has done in EMG, the brain can be retrained to regain control over the muscles that it has not lost control of. So pictorially represented here. So imagine a stroke patient with insult injury to the brain, and the two nodes don't communicate. Through this feedback, it's creating two alternate pathways above and below the area of insult, just for illustrative purposes. And now the signals can travel back and forth between the two nodes. Another simple illustration is there's metro construction going in Chennai, so there's a lot of diversion of traffic. So you can think of this new pathway that's being created because of this metro work as new pathways that help you travel from one point of the city to another point. So that's exactly what this treatment does. It's non-invasive. There's enough evidence to show that this works across a variety of disease indications. Very, very successful. So this is an fMRI study done on patients with stress urinary incontinence. Whereas before the treatment, which is the picture on the left, you see that the additional somatomotor areas of the brain are lighting up. You see the red point in the images. After the biofeedback treatment, that has disappeared because of the learned behavior and automation of the new skill of controlling the muscle. All those red spots disappeared. The patient has recovered from stress urinary incontinence. So there's enough evidence to prove that this thing works, and this is what we have created, a very, very easy way to deliver treatment to patients with these conditions. We've done a number of studies. These are patients, for example, with what's known as voiding dysfunction, or VESD. We've seen excellent results, and this has been published, presented at international forums like AINU and all. So two patients in particular I just want to highlight. These are patients from Chennai that we have the privilege of treating. Both patients had what's known as spina bifida condition. Patient number one presenting with voiding dysfunction. No treatment worked for this patient. It's a 30-year-old female bank employee using a catheter to void the urine. So imagine a bank employee going into the bathroom, putting a catheter to empty the bladder 5-6 times during the workday. Not easy. So that covers her life. Never thought she was going to get married, have a normal life. But after 13 sessions of treatment, she's gotten rid of the catheter. She's able to void naturally. And the last I heard is a year ago, she thought a good man, got married, having a very normal family life. Second patient, a 5-year-old male with stress incontinence, secondary to spina bifida, improved after 10 sessions of treatment. And both of these patients have discontinued this medication, leading very, very normal life. So this is the impact we've had on these two patients who are like local to Chennai, local to Tamil Nadu. This treatment technique, biofeedback, is accepted as the first line of treatment in the Western countries, especially US, UK, etc., as well as Australia. And as I said before, there has not been an easy-to-use device where even doctors can prescribe and say, go have the treatment. So this is where we have come in, created a whole service layer around the technology that makes it very, very easy to consume and for patients to get better. So I've talked a lot about urinary incontinence, and that's the focus of our relationship with AINU. But besides urology, we're also very effective treating post-stroke disorders of movement, tremors due to Parkinson's, essential tremors, and also a lot of the chronic pain indications, cancer pain, chronic low back pain, migraine, etc. Also very, very effective treating gastro indications such as dysphagia, which is swallowing disorder, defecation disorders, and so on. So this is the patient whose video I'm going to share. We have permission to share. So she was 19 years old when she came to our clinic in Chennai. She came from Mumbai, had stroke at the age of 9 and ended up with what's known as focal dystonia, spasticity on the upper right arm. And you see how her right fingers are presenting versus the left fingers, which are very, very normal. And she had Botox treatment for about 9 years. So every 3 months she would go see a neurologist, get injected with Botox, and then she would open up her right finger, and after 3 or 4 months, the fingers would clench back like this, and she'll again go for a Botox injection. So this is on day 1 when she came into therapy, and you see how she's presenting. She can't fully stretch her right arm because of spasticity, lots of pain on the right shoulder. Again, you can see how her fingers are presenting. And this is the biofeedback treatment with the JOGO unit hooked up to the patient. He's getting trained on how to relax those spastic muscles. And over an 8-week treatment period, she made a major improvement. And this was the first time she was able to achieve this without a Botox injection. This is very, very exciting for the neurologist. We complemented the biofeedback therapy with regular physical therapy. And this was the first time she was able to self-drain without the help of her mother. Very important for a young lady. And here you can see her doing a very smooth cylindrical grasp and release without the help of a Botox injection. So we followed up with this patient 6 months, 12 months, 18 months after the treatment. He retained the improvement, doing very well. So this is the kind of impact we're able to bring with this therapy. Also have very good data with Parkinson's tremors. We're able to control tremors voluntarily through the aid of this biofeedback treatment. And as you know, this is a very, very progressive condition. Neurologists keep on increasing the dosage because the tremors keep on increasing. And at some point, they cannot tolerate the dosage anymore. So they see this as an exciting adjuvant treatment. So along with the drug, you can give this biofeedback treatment and reduce the increase in the medication dosage. There's better manageability over the lifetime of the patient. So in terms of pain, this is Dr. John Sarno, who worked with Dr. Joe Brodney at NYU. So he coined this term for neuroplastic pain, which was a very new concept in the 90s, that this is a pain not due to injury, but due to the pain circuit to the brain. It was a very, very new concept. Nobody accepted it. It took about 20 years for this to become more mainstream. Now it's really accepted that pain can be unlearned through this biofeedback mechanism. There's something called central pain, which this treatment can impact. And this is also relevant in pelvic pain. We've seen very good results with chronic pelvic pain responding very well to the biofeedback treatment. So this is a study on low back pain done at Harvard University, showing excellent results, pre and post. BPI severity is a gold standard for measuring pain, to be an excellent reduction in pain measured through BPI. Interestingly, although not a head-to-head comparison, with drugs like oxycodone and paclitaxel, which are, used to be the go-to treatment. This is much better than these options at the moment. Exciting for pain physicians. From a migraine perspective, again, excellent data. This study was led by Dr. Bernstein, one of the leading lights in migraine, one of the KOLs in this space, showing very good results in terms of reduction in disability, reduction in frequency. We were able to reduce the triggers for migraine by training the patient's brain how to respond to those. We have been lucky to build an excellent team, both in the US and in India. Our medical advisory board, doctors from AINU, Harvard, Columbia, etc. And they have really helped us not only create the protocol, the evidence, but also position this treatment vis-a-vis other treatments on the market. So these are academic medical centers in the US that are prescribing the JOGO treatment. So these are the top hospitals in the US: Mayo Clinic, the UMass Memorial, Weill Cornell, Mount Sinai. And most often they have an older generation machine that's able to do the same thing, but that's never been used because it's very, very difficult to use. So that's why they see the JOGO technology as a game changer. We also have been very lucky to get the endorsement and the acceptance from the leading hospitals, including AINU, for this treatment. And we're looking forward to working with the team here at AINU and make this a big success for the patients here. So with that, I want to thank the doctors here again for having us here today, and looking forward once again to making this a big success. Thank you so much.
So I think Mr. Sanjay already shared these things. So we are based out of New Jersey in US, and we have operations in India, Canada, and Malaysia. We have Sanjay Murthy, the founder, and we also Shivan Abraja, the co-founder. And what is JOGO device? It's an AI-driven device with wearable sensors. Basically, it's a big, bulky, old Dynora TV type of machine. It has become into a small wearable sensor. And the beauty of this is, it also works virtually. We treat around 20 countries sitting from Chennai. So we ship the device to the patient's home, and using virtual platforms, we are able to treat. And it's FDA approved. And these are the two founders. The name JOGO comes from two founders. One is Joseph Radhi, which Sanjay mentioned, a urologist come physiatrist, and Gordon Silverman, who is the inventor of FastPack, which we call in the US as the easiest fast. So basically what the difference is, it's portable, so we can carry it anywhere. It's as small as this, which will show you in subsequent slides. Non-invasive, the previous EMG was the needle EMG, and it's digital, and it works real time with no lag time. I think this slide is already shown. So basically, we rewire the brain with the help of neuroplasticity. So this device is more like an enabler. It's just like a thermometer showing the temperature. It tells the muscle strength, and the beauty of the device is it can go up to 1,000th of a millivolt. In fact, almost November last year, I was invited to the Apollo Indraprastha Hospital, so we did a demo there to the head of VR, and they showed that we also have 5 feedbacks of how it is different. But when they saw a device, they said this is miles apart. So, I'll just show a small demo of JOGO.
So you know much human condition. JOGO is an AI-driven device with wearable sensors applying the science of EMG biofeedback, facilitating neuroplasticity. JOGO taps into the natural neuroplasticity of the central nervous system by creating alternate neuronal pathways to gain control over affected muscles. The signal provides immediate information about the patient's muscle activity and displays it on the tablet screen, enabling accurate information on muscle activity to the therapist. Here is a brief demonstration.
These are electrodes which are the same as what we use in ECG, and we attach this on any part of the body where we want to measure how the muscle is working. So the surface EMG can be applied for all superficial muscles. This is our sensor, and this is our own patented product. With this, we are able to see the output on a tablet screen. So therefore, we call it as a digital therapeutics. We use ultrasonic swabs to prepare the skin, and it also reduces the skin resistance. For the sake of demonstration, I'm going to do it on the wrist extensor. I connect the electrodes with the lead and then stick it on to the part of the body. I connect this with a strap, I click on the JOGO app and update the patient information. So the tablet is connected to the sensor via Bluetooth. Up, down, up, down. Now what you can see is that this is giving a real-time feedback to her. As I mentioned, lifting it up, you can see the graph going up. When she comes down, the graph comes down. I'm going to take a screenshot of this. This is a frame where I have captured her response and I can always send it by email to any person. The biggest advantage of JOGO is that if the patient is completely active, as they move, they are able to see how the graph is changing, as well as objectively measure their own performance. And this helps to motivate the patient, because now the person is able to understand how much the intensity of output they are able to generate, and there they are. As I had mentioned earlier, you can always compare previous performance with the current performance. JOGO has three main advantages. Number one, it is assessment and tracking. We can always identify what is their baseline, and then I'm able to track it, because I can take a screenshot. I can always compare yesterday and today. This graph serves as a reinforcement of motivation both to the patient as well as to the clinician. Number two is validation of the treatment. We can validate the exercise by using JOGO and telling the patient to do the same thing with and without support. And with the help of JOGO, we are able to understand how the patient is responding, because this is totally customized according to that particular patient. The third advantage of JOGO was the biofeedback, where the person had a target, they were looking at the line and they were trying to touch the line and then come back, where they learned to control the amount of muscle activity. So this is a way in which we can use it as a biofeedback, and we can also say this as a EMG guided exercise.
During the period in November, she was suffering from urinary incontinence for almost 36 years. She used to have almost 4 to 5 diapers a day. And after 10 sessions, in fact, the first session when she came, we laid her on the bed, the entire bed was wet with urine. From there, after 10 sessions, she completely walked without any diapers. And today she is living with just one diaper when she goes for travel, otherwise she is completely well. Like this, we have taken almost 2,000 patients in pelvic floor disorder. And the oldest patient we have taken is 90 years old. The youngest patient is 5 years old. In fact, we are doing a veterinary study in Cyprus. In fact, also we are having a lot of promise in gastroenterology also, like what Sanjay mentioned in veterinary litigation. In fact, we are doing a study post LAR also very soon. So these are kind of patients we treat. And I think these are some benefits. We are USFDA approved, and we also got a special status called breakthrough device, which is given to 1% of all devices, especially for chronic low back pain, which means there is no parallel with JOGO. And we are, our clinic is JCI accredited. In fact, in one category, under ambulatory care, we are the world's first digital rehab. And we have clinical partnership with Harvard, Mayo Clinic, and these are the conditions what we treat that we already captured. And we work with hospitals, hospitals, geriatric care, home visits, telemedicine, and doctor clinics. And today we are present in 10 cities. We have a team at the street now. Today we are colleagues are treating in Vedanta, Gandaram, and all the major hospitals across the country. And we are from hospitals where we have tie-up where we go and do service every day, or weekly, 2 days, 3 days, etc. across basically in Chennai and Bangalore, and now we start operating across the country. And we also get prescriptions or referrals from many hospitals across the country. And I think it's also shown. We are also under insurance in the US, and very soon we are planning India also. And just something very interesting for, if you look back at 1999, 98, mobile phones came and disrupted the entire, technology, and today it's affecting the entire world. Similarly, digital health, the size of the market is around 200 billion. And the next 10 years is going to become 800 billion with a growth of 50% CAGR. And US is going to grow only 1.5 times higher, it's going at 25%. And this is not just restricted to one particular therapy, but across all specialties. You can look at diabetes, obesity, smoking, etc. And like us, there are 3 lakh companies across the world which are going to come very soon, and this is going to change the entire landscape in healthcare. And there is an estimate that says with 2035, pharmaceutical drugs will be overtaken by digital health. So that's the kind of thing we're doing. And in 2021, US FDA gave a special ruling that if a drug is going off patent, if you combine it with usual therapy, you can extend the patent. So a lot of pharma companies are already tying up with a lot of disease therapy companies to extend the patent. And as you all know, that life expectancy is increasing in the next 10 years from 71 to 84, and that is where, lot of issues come, and we see urinary incontinence is a major issue with people after 60 years, 70 years. And after 70, the incidence is almost 70%, and above 80 is almost every patient. And we are also doing some studies, as Mr. Sanjay mentioned. And this is how the patient journey comes. When the first time he comes, we do a thorough assessment which goes for 1.5 hours, 75 minutes to 90 minutes. And then the session starts, and on day one, we give a report to the same clinician, and again, midterm, and then on the end, on discharge. And we also have a comprehensive integrated patient care, so a lot of touch points for the patient. We give a bladder diary, we give a nutrition support, we also give, a psychologist. Many patients have anxieties, and we also have speech therapy for other unions, and that's what we do. So we have a team of almost 50 doctors across the country, and all of them are trained. The head of the operation, head of pelvic floor is Suma Venkateshan. She's been doing pelvic floor therapy from 1986. She's treated more than 6,000 patients. She's a regular speaker in all the urology and gastroenterology conferences. And I'm sure that together we'll be able to impact more patients to live a life without diapers and without plastics. Thank you.
On behalf of patients of urology, urology, I welcome Mr. Sanjay Modi, from Dr. and Dr. Problem for this event where we are planning to collaborate with JOGO and a long-term basis so that our patients get the maximum benefit of this cutting-edge digital platform. Unfortunately, this field of chronic pain and incontinence has been much neglected by urologists for the field of years because it is not a field where we have instant relief, or like not a surgery where we perform a procedure and get instant gratification or relief. These are patients that need to be slowly spoken to, medicines to be started, and eventually we find that the results are not that great, and it comes to a point when we try to tell these patients to go somewhere else. That's what's been happening for a very long time. And functional urology in the last has unfortunately been neglected the field in India, that's not in China alone. And that's one of the main reasons that we are now getting our consultant Dr. Madhusekaran to do a fellowship in functional urology in France. And he's going to go for a specialized program in the next 6 months. So hopefully that should also increase on patient results that come to us for all these problems. I've personally seen few of our patients for getting real good benefits, especially one where we can say that we were sort of lost for ideas of one young gentleman with severe DESD. And I think he's providing very great testament of technology and how hopefully you find many more patients and establish this as a center for referral for all urological problems and incontinence patients. Thanks for being here. That's all this happening today. Thank you.
Yeah, does it work on electrical signal? But you are putting electrodes. Normally electrodes only show the test some wave, something like that. How it goes to brain? It is only electrical signal only goes to brain, and
So there's nothing going into the body. It's actually the reverse. We are reading the electrical signal on the body and displaying it. And through the eyes, the brain is able to recognize what's done. So the patient will not feel anything. If you've taken an ECG test, it's just like that. So you don't feel anything, but you see the graph. Instead of EMG is a special form of ECG. Or I should say the other way. ECG is an instance of EMG specific to the heart. This is specific to the muscle that we are training so that there is improvement in the system. like Dr. Arun said, they've lost control. It's a mechanical problem. The muscle is not working to release the urine, etc. So there's no surgical intervention. Because everything else is good. The control mechanism has been impaired. So to rebuild the control mechanism, we have to use biofeedback technique.
Should it used by under medical supervision, or the patient can do it themselves?
So it needs to be evaluated thoroughly. So our therapists are trained on how to evaluate patients. We get prescriptions from urologists. They go through a very comprehensive evaluation session or assessment session. And then they'll figure out what is the right protocol for this patient, how to train the patient, educate the patient, like Dr. Arun was mentioning. We have to educate them how this thing works, and then give them an idea of how this whole treatment session will go from step 1 to step 2. Yes. So there is a specific training program for this, and it's one of the more specialized training in this program.
I understood that it is used for only non-critical applications. Can it be used for critical applications also?
This is non-critical, critical is different terms. This what is non-critical to us may be critical for somebody else. Imagine a patient who's been using diapers all his life, using 10 to 20 diapers per day, is not able to control the urination. And he is not able to understand why he is not able to control the urination. This is because of weakness of muscles or the muscles have got some sort of change following some problem like a stroke or something. So the muscles are all not functioning properly. So how to retrain the muscles, how to get it back is what the biofeedback and JOGO does. So what JOGO does is, where is the muscle non-functioning, how is the muscle non-functioning, will be given on a, like a ECG, will be given on a digital thing to the patient. So when the patient sees that, he understands what muscle, and it doesn't stop with that. It doesn't stop with interpreting what the problem is. The physiotherapist will train how to overcome that problem by relaxing that muscle or tightening that muscle or whatever it is. So when patients understand what is happening through a feedback, because this is not, because we can tell, you can close your finger and close it, that we can see. But internally, when somebody is going to a muscle, how do we know that they are closing or shutting the muscle? The patient might think that I am doing it properly. But where is the feedback? How do we know that this is being done properly? And that's where the devices come there. So the patient themselves will know on their screen that yes, that muscle what we want to contract or relax is being contracted and relaxed. And once they start learning, as the brain starts to process that thing, the brain will start to learn this thing, and eventually the control of the muscle will come. And this is not something like, it's not a very uncommon thing. A lot of people who have spinal cord injuries, who have stroke, who are born with some spinal cord defects in childhood, these things cannot be corrected surgically. Any nerve issues, it's difficult to repair nervous tissue with surgery. Unlike the heart or something where we can do something or do some surgical procedures, unfortunately all neurological problems have to be corrected only with learning of the brain. And that's where JOGO comes in. And we have a lot of urological patients, both have urinary control issues and bowel problems in patients with neurological problems. And just physiotherapy helps them, but not to the extent of having a biofeedback. The excellent results are seen only with biofeedback, and that's where JOGO plays a major part in training.
Thank you.
What will be the cost of the treatment and how many sessions would the patient?
As I said, that from 5 to 6 sessions they do, and cost-wise they will buy.
So especially for this pelvic therapy, close to 11 sessions we are going to give it to the patients, and the total cost will be close to 3,000 rupees as a package. And for every session we are going to spend around 1.5 hours towards the patient. So there will be a detailing of the muscle movement, and the patient will get the feedback. Without the feedback also the muscles will get trained. So, and moreover, we are now having a psychologist in place as well as the dietitian wellness in place. So, as a put together, as a holistic approach, we are charging 13,000 rupees as the cost.
How much?
33,000.
33,000.
And for 11 sessions.
The duration will come for 11 sessions.
Duration, it's close to 4 months. There is a validity period is there. So in the 4 months, the patients can take weekly 1 session can be trained towards the patient.
So accuracy எவ்வளோ கரெக்டாக இருக்கு?
Accuracy or efficacy? Both mean the same. Around 90-95% success with this treatment. Very, very effective.
So you have covered all diseases except heart. Can you use for heart-related?
No.
Period.
So there's something called Kegel exercise, pelvic floor exercise that are being prescribed by physiotherapists. So I know we did say that biofeedback, but then we've been doing it forever. So why would we need this biofeedback if there's been effective so far?
Very good question. More qualified.
Kegel exercise is specifically for people to strengthen their pelvic floor exercise. So to strengthen their pelvic floor muscles. So patients who have females and a lot of delivery, who have incontinence of urine, coughing of sneezing, it's how we teach them how to contract the muscle, how to contract the pelvic floor. As I said, most of the early or very minimal specific incontinence can be treated with Kegel exercise. But how do we know that whatever exercises they are doing is correct? Or how do we know that they are doing it to a certain extent to which to control the muscle? So that if there is a feedback to the patient. And this is not for ordinary, we are not recommending those sessions to everybody who has, we just teach them Kegel. But how would people who fail Kegel, who say that they are still incontinent after Kegel? So we need to assess why are they failing to Kegel exercises and what do we need to do more. And that's where JOGO comes in. We need more of strengthening and whether they are doing it properly, that can be assessed with JOGO devices. Second thing, not everything needs only strengthening. Pelvic floor exercises only focus on strengthening the muscle. There may be situations where you need to relax the muscle also. So how to relax the pelvic floor muscle for patients who have chronic constipation? They may be doing the exercises to control more, but and that could lead to other effects also. So we need to know, so we have to assess what is the problem. If it was plain stress urinary incontinence, then Kegel exercise is more than enough. Kegel exercise, if they fail or if patient is little more complex urinary issues or bowel issues, we refer them to biofeedback. So this is a supplement to that. This is an added thing to existing pelvic floor exercises, which helps us to more accuracy on how to do it and when to do it.
So further to that, would we find a time where, would there be a day when we can do it? We don't need this equipment, we don't need hospital, but we can just...
Obviously, this is not a continuing treatment. This is just to...
No, I think the electrodes is just like your watch. You can wear a watch.
Probably, see, as Mr. was telling, and I was telling that look at the older device. So, measuring the muscle contraction, ECG is electrocardiography, EMG is electromyography. To measure that, it's not easy to measure muscle activity. So they had such a big, huge machine, and now it has come to a small device. That's where technology is developing. It will come down. It will probably come down to a thing where it's like available everywhere within your smartwatch and everywhere, just to tell you what is the efficacy and what is the effect of that. This will come. Okay.
So today it's this small. I think wait for 2-3 years and then become the size of a pinky. You just stick it on your muscle and you can keep working. So we are working on it. Hopefully next time you come here, we'll give you a set of Bindi packets to take home. So just one note on the cost, we also use imported components. the electrodes and their accessories come from the West. That also adds to the cost.
I think we should mention what difference of cost is going to cost for the same therapy in US and outside.
So US, the same therapy would at least be 4 times more expensive.
Thank you very much for all your patient listening towards Sunday presentation and we will have a small photograph.